Hello everyone, welcome back to my channel. So in today's video we're going to discuss about the upper limb massage. So starting from the scapular region and shoulder, progressing down to the hands and fingers. This session is especially designed for secondary students, but it is equally helpful for interns as well and clinicians who want to revise fundamentals. So massage is not just a mechanical skill, it is a clinical tool that requires sound knowledge of anatomy, biomechanics, patient positioning, indication and contraindication. So let us begin with the foundation. Yeah. So anatomical and biomechanical foundation. So before performing any massage, it is essential to revise the anatomy of upper limb. So the skeletal components include the clavicle, scapula, humerus, radius, ulna, carpal bones, metacarpals, and phalanges. So identifying bone landmarks like the acromion, spine of scapula, medial, lateral epicondyles is crucial to apply correct pressure and avoid neurovascular structures. So from a muscular perspective, we focus on scapular muscles such as trapezius, rhomboids, levator scapulae, shoulder stabilizers including the rotator cuffs, and upper arm muscles like biceps and triceps, and forearm flexors and extensors group, intrinsic muscles of hand as well. So understanding the biomechanics helps us respect normal ranges of motion and then avoid overstretching, especially in painful and post-injury conditions. Yeah. So general massage principles and techniques. So never look at the basic now we look at the basic massage techniques, so which form the backbone of upper limb massage. So effleurage, which consists of long gliding strokes. It is usually the starting stroke, helping to warm the tissues, spread lubricant and promote relaxation. So petrissage includes kneading, lifting and squeezing movements. This technique is excellent for releasing muscle tension and improve circulation, whereas tapotement involves a rhythmic tapping movement, so it is used sparingly for stimulation, especially in athletes or hypotonic muscles. So friction is a deeper technique applied in circular or transverse motions. It is particularly useful for tendon attachments, scar tissues and adhesions, so but should be performed cautiously. Yeah, coming to the scapular and shoulder region massage. So scapular region plays a major role in shoulder mobility. However, we focus on muscles such as upper limb, upper and middle trapezius, rhomboids, levator scapulae, and rotator cuff muscles. So the techniques used include deep effleurage along the muscle fibers, cross fiber friction near the attachments, so gentle stretching to improve scapulothoracic mobility. So this area is commonly affected in patients with postural dysfunction, frozen shoulder and cervical related shoulder pain. Yeah, so the coming to the upper limb and elbow massage. So moving down to the upper arm, we address the biceps brachii and triceps brachii. Massage is applied along the muscle belly, so followed by careful work near the tendons at the elbow joint. Gentle passive massage can be combined with the massage to improve joint play and circulation. So this is particularly helpful in tendinitis, post immobilization stiffness, and overuse or injuries. So coming to the forearm, wrist and hand massage, the forearm muscles are often overworked due to repetitive activities. So the flexor group is treated with deep stroking and kneading, whereas the extensor group benefits from the thumb stripping techniques. So gentle friction is applied over the intraosseous membrane. So at the wrist and the hand, the carpal bones are generally gently mobilized. Thenar and hypothenar emergence are massaged. Light strokes help to reduce the edema and provide dexterity. Yeah, this is what I was talking about. The carpal bones, gentle articulation for mobility, thenar and hypothenar muscles, and light strokes helps to reduce edema and dexterity. And coming to the specific techniques, the clinical considerations and conclusion. So always remember the contraindications such as acute inflammation, fractures, infections, and open wounds. So a proper patient positioning like supine or prone, according to the patient condition or the patient wish or the comfortableness of the patient, so the positioning of the patient is done accordingly, whether it is supine position or prone position. So it must ensure comfort and therapist efficiency. So to conclude, mastery of upper limb massage requires practice, anatomical knowledge and clinical reasoning, as we talked about the anatomy or the basics, the biomechanics of upper limb, and the anatomical knowledge and the clinical reasoning. So this is all about today. Thank you.